If you're living with pulmonary arterial hypertension, you may face unique challenges in navigating an exercise routine. In this episode of PH Insights, we'll explore how personalized and safe exercise plans can improve symptoms, boost cardiovascular health, and enhance quality of life. We'll look at the science behind PAH and discuss the role of physical activity in managing it, and share practical tips to help patients stay active. Whether living with PAH or supporting someone who is, this episode will offer insights to help you move forward with confidence.
Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension.
Hi, my name is Angela, and welcome to PH Insights. Today we are going to discuss pulmonary arterial hypertension, or PAH, and how a safe exercise routine may help with long-term management. Joining me today is Dr. Akshay Muralidhar. Dr. Muralidhar, thank you so much for being here. Can you share a little bit more about your role and connection to PAH?
Thank you, Angela, for having me and for this wonderful podcast and for the opportunity to speak via this podcast to the audience of the PHA. I am a pulmonary vascular disease specialist. I am the director of the Pulmonary Hypertension Comprehensive Care Center at Arizona Pulmonary Specialists in Phoenix, Arizona. And we've been a center for over 20 years, and I've been serving as co-director for the last two. I completed my training at the University of Colorado in 2019 and have been in Phoenix ever since then. My connection with the PHA is, again, as part of the PHA Center of Excellence. We have a strong connection with the PHA, and we've been building it ever since we've had this relationship. And I personally have had the relationship ever since I was a fellow.
Yeah, thank you. And are you a support group leader?
I am. It's incredibly exciting. We restarted the support group after taking, of course, a hiatus during the COVID pandemic, and it's been incredibly rewarding for our center. It's exciting to lead those groups.
Awesome. So if you are in the Phoenix area and looking for a support group, there is one available. You can always check our website for that information. I would also like to say that you were a member of our speaker team at our PH Community Workshop, which was recently in Phoenix in 2024. So thank you again for participating in that.
Anytime. Thank you for inviting me. It was a wonderful experience for me personally and for our center at large. I think we had a lot of information to discuss, a lot of wonderful patients that we met, and I thought it was an incredibly rewarding experience. It was wonderful.
Yeah, so thank you. Thank you for those kind words as well. I would like to shift back to our topic today. Like I mentioned earlier, we are discussing PAH, we are discussing exercise and understanding its importance to creating a routine that works best. But before we get started, I would like to take a moment to discuss PAH as a whole. In previous episodes, we have discussed group 1, which is pulmonary arterial hypertension. But just so everyone on this episode has a baseline of information, can you share what PAH is, the causes, maybe some signs and symptoms our listeners should be aware of?
Absolutely. Pulmonary arterial hypertension is a devastating diagnosis that affects many people in this country and in the world at large. And it is important to understand the signs and symptoms early on, because treatment early on is exceedingly important to having a good quality of life and getting the disease under control. What pulmonary arterial hypertension is essentially damage to the blood vessels that go from the right side of the heart to the lungs, the pulmonary vascular system, which carries oxygen poor blood from the heart to the lungs so that they can get oxygen and thereby oxygenate the tissues and the rest of the body. When there is direct damage to the blood vessels that go from the heart to the lungs, this can cause increased need for oxygen, lack of oxygen, and ultimately can result in high blood pressure in the lungs, thereby the name pulmonary hypertension. And in advanced cases can cause the right side of the heart to fail, resulting in heart failure. And if left untreated, unfortunately can cause death. So it is incredibly important to identify these symptoms early on and seek expert care as soon as possible so that the disease can be mitigated by various therapies. Thankfully, there are therapies available, many therapies that can really improve quality of life. Now, why this is important for people as it relates to our topic of exercise is most patients of mine don't present early on with symptoms of complete heart failure where they end up in the hospital and aren't able to breathe just by sitting there. Most of the time, the first symptom is activity intolerance, meaning people get short of breath doing exercising or doing what we call their normal activities of daily living. I often have people who, are avid hikers who just realize, no, I can still do everything okay, but I'm just not able to, hike as much as I used to. Or people can't climb stairs as much anymore. They're unable to go around the grocery store like they once do to. And this can all happen months, if not even years, before they develop signs and symptoms of right heart failure. And that may be the earliest sign of this disease developing. So it is incredibly important when I see those symptoms to think about pulmonary arterial hypertension and to think about whether we're diagnosing it early on, because of those symptoms can be subtle but exercise related. Pulmonary arterial hypertension is caused by many disease states, including autoimmune diseases such as scleroderma, drugs and toxins, as well as blood clots in the lungs, something called chronic thromboembolic pulmonary hypertension. And sometimes it has what we call an unknown cause or idiopathic pulmonary arterial hypertension. And when you come to your expert center for diagnosis and management, oftentimes testing will include trying to determine what the causes are because the treatment varies depending on the type of pulmonary hypertension you have.
So someone may come across this episode of the podcast because they see we're talking about exercise and, they're learning something about pulmonary arterial hypertension. You mentioned that the activity intolerance may be the first signs of PAH or PH. Is it something to just stay mindful of if it worsens, or would you suggest, talking to your doctor about it to make sure that they're aware, because some doctors aren't aware of PH or PAH, just to let their team know that maybe this is something I'm dealing with?
That's right. And that's a great thought. Basically, pulmonary hypertension is one of several potential causes for activity intolerance. So I think the first step is if you notice anything that is progressive activity intolerance that isn't seem to be getting better, I would very much encourage discussing it with your primary care physician or pulmonologist or cardiologist about your worsening activity intolerance. Now, while pulmonary arterial hypertension in the spectrum of all diseases is relatively rare, thankfully, it is important to do a workup of your symptoms to make sure that you don't have some illness that may be causing your symptoms. And that should include at least a evaluation for pulmonary hypertension, even if it's simply a symptom discussion, making sure that may not be the process going on. Because unfortunately, it is a rare condition. Oftentimes, there is a substantial delay in diagnosis for pulmonary hypertension only because providers may not think about it early on. And so while there are several causes of activity intolerance that are out there that can be medically important and important to identify, I think early testing and diagnosis for pulmonary arterial hypertension, even if it's as simple as getting a 6-minute walk distance or an echocardiogram, something that's relatively less invasive, to at least get an idea if there is a hint towards this. Of course, the gold standard is still a right heart catheterization, but at least trying to see if there's any hint towards this developing, I think, is incredibly important.
Thank you for clarifying that. And I will also like to reference, for anyone who wants just more of an overview of this information, please feel free to check out our first episode of the podcast, Filling in the Blanks with Dr. Jenny Yang. Again, we go over some of those groups and more details about the tests available. Now, how does this diagnosis of pulmonary arterial hypertension affect daily living specifically when it comes to physical activity?
That's a great question. I think, as we talked about before, the early signs and symptoms of developing pulmonary hypertension is often activity intolerance, such as not being able to exercise the way you used to, or not being able to do the things that you normally do that do require physical activity. This is because physiologically, the heart may not handle the strain caused by the high blood pressure in the lungs when there's no activity. But during normal physiological activity, the heart is required to pump more blood faster to the lungs so that the lungs can replenish the oxygen supply in the blood quicker. The heart does this by either pumping more blood per beat or by beating faster to get more blood across the lungs. It prefers to pump more blood per beat, but sometimes if it's under strain, it will pump faster. And so oftentimes the earliest signs of activity intolerance is an increased heart rate relative to the amount of activity someone is doing. And we can capture that very easily with what we call a 6-minute walk test, which is very common in pulmonary hypertension centers. Basically, we just walk you for 6 minutes and see how you do. In people, when they're looking for symptoms like this, it's just going around the grocery store. Does that make you more short of breath? Going upstairs, does that make you more short of breath? Going for a hike. Okay, I had one patient told me he had no symptoms except that he would love to hike every Saturday morning and he just couldn't anymore. Turns out that he had connective tissue disease related pulmonary hypertension that we discovered on exercise right heart cath. So realizing that you're not able to do something that you were able to do before, even if it doesn't seem, as bothersome, might be the earliest sign of something going on. One thing I will also mention is that a lot of times patients, who come to me with severe pulmonary hypertension, once we talk about it a little bit more and get them on therapy, they look back and say, you know what? About a year ago or about 6 months ago, I probably could have told you I wasn't doing what I used to do before. Like I used to love going on walks with my dog and, we would go up this hill and we weren't able to anymore. And I didn't think too much of it. I thought, maybe I was getting old or, I was just having issues related to my legs. And now think about it, I think that might have been the first sign and symptoms of pulmonary hypertension. So it's amazing what people, patients tell me about how they may have been diagnosed, which tells me that the heart was already under a substantial amount of strain early on. And it's just, it was adapting because the body is adaptable and the body will try and adapt for some period of time until it cannot anymore, until the heart cannot anymore. And that's when the symptoms become substantially worse. But if they think about it, a lot of patients tell me that their symptoms started much earlier than they originally thought.
Yeah, I think that's a great point. For so many people with any diagnosis, there's a lot of things we put off, right? There's a lot of things we kind of ignore. Maybe it's just old age, or maybe I put on a little weight. But there are some things where if you've consistently been able to do, and all of a sudden there's this drastic change or stop, that maybe you need to think about a little bit closely. Thinking through your medical history as you actually receive your diagnosis, like those little aha moments where that may have been the start for me, I think will be really beneficial as listeners listen to this episode and think through their daily living. So you mentioned how PAH can influence levels of activity that a person could sustain. So how can incorporating a safe exercise plan or routine help to improve the cardiovascular health for a patient? And how does that become beneficial for them?
That's a great question. I think the key word that you had mentioned in your question, which I think is important to amplify, is safe exercise. In other words, exercise is safe in pulmonary hypertension. And I want to make that very clear because it is actually something that, up until fairly recently, it was the opposite was the recommendation that exercise was actually dangerous for you. And we've learned many lessons since then. And we now, have almost, I don't want to say have done a 180, but we've really learned to talk about how to safely exercise in pulmonary hypertension because we know from data that it can improve quality of life and outcomes in PAH. Let me back up to a little bit when we talk about the first diagnosis of PAH. I think that exercise is safe in almost any circumstances when you have PAH. The only exception to that would potentially be when you have come in with severe symptoms and you have yet to be started on therapy for pulmonary hypertension. In those situations, when you're undergoing testing, when you have severe symptoms of heart failure, that may be the only time I ask my patients to maybe take it easy until we get the appropriate testing done and the treatment started. The moment we do is the moment I tell my patients, I'm glad you're feeling better sitting on the couch. It's time to get up and move because I think that is incredibly important to start discussing how we can get you back into motion. The body was not built for rest indefinitely, and it should not be put at rest indefinitely. You lose what you don't use. And this is especially true in pulmonary hypertension. And remember that most patients who come in pulmonary hypertension, have either had a delayed diagnosis or have been experiencing some degree of activity intolerance for months, if not years before. So they've already lost a lot of their functional capacity that they had before. And our job is to regain it. And the only way to do that is with activity in a supervised fashion. And, the first step that I tell my patients always is to enroll in a cardiopulmonary rehabilitation program. In my patients that are able to enroll, that is the best first step because it is a supervised exercise regimen that allows patients to learn how to regain what they've lost. I always tell my patients, don't take it from 0 to 60 in 1 second because your heart is not used to it yet. It will get there, but you have to set realistic goals to be able to do that. And there is no better place to start than a good cardiopulmonary rehabilitation program, which is offered by many centers across the country. If patients are not able to enroll in cardiopulmonary rehabilitation programs for various reasons, we discuss different exercise regimens that we can talk about, specifically discussing how to vary exercises across the spectrum of activity. So, aerobic exercises, some strength training exercises, and yoga, for example, are all important to get that lost cardiopulmonary function back to where it was. The amazing thing about the human body is it has a capacity to heal when given the appropriate circumstances. And I think that exercise is just as important as any medication I put patients on. In fact, more important than any medication I put patients on in a lot of situations to get that lost quality of life back. Exercise not only, improves muscle mass, improves muscle efficiency, allows the muscles to efficiently use the oxygen that they're now getting, which, by the way, is a golden resource for the muscles, given that the pulmonary hypertension is limiting how much oxygen they get. So being able to do that is incredibly important as well. It releases endorphins, improves bone strength, and improves sleep at night, all of which are incredibly positive factors in improving patients' quality of life with pulmonary arterial hypertension. So I tell my patients medications are only part of the process. They're meant to enable my patients to get back to the activities that they're used to doing and learn what they like. And by far and large, my patients love that. And in fact, a lot of times when they've realized what they've lost, they are that much more motivated to get it back and in fact exceed it. And I think that's a wonderful goal to keep, to talk with your physician about in a stepwise fashion, starting, of course, if possible, with a cardiopulmonary rehabilitation program.
With the rehab, what is the typical process for reaching out and being able to enroll in such a program?
So the great thing about being treated as a PHA expert center is that we have access to cardiopulmonary rehab programs. If it's not within the institution itself, at least a strong referral basis for cardiopulmonary rehab programs in the nearby region. Typically, cardiopulmonary rehab programs do require physician prescription and recommendation to do so, which I do think is important because you want to make sure you're adequately treated with medication for pulmonary arterial hypertension before doing it. A lot of them require pulmonary function testing beforehand and things of that nature. It is important to enroll in a cardiopulmonary rehab program at the appropriate stage in your diagnosis and management, and that requires a conversation with your physician. But once the prescription is made and the appointments are set up, the process then goes to the rehab center, which usually contacts you. And in general, it's a group of people with similar, cardiorespiratory diseases, which actually where a lot of my patients outside of formal support groups actually find their support, because these are patients suffering from, if not the same disease, very similar diseases. Honestly, sometimes the first time that they met somebody who's going through what they're going through and being able to manage that. And once they get into a cardiopulmonary rehab program, it's a highly supervised exercise program. And it's supervised, there is a physician, usually a physician supervisor for the program in general, and then respiratory therapists who kind of monitor you. A lot of times, patients who need oxygen with exercise will get an idea of exactly how much oxygen they need during exercise, because a lot of times it's difficult to identify that. We usually try and prescribe an oxygen level based on 6-minute walk distances and things like that, but that's not necessarily the same degree of activity that they can do. So being able to get an idea of how much oxygen you need, which is very important, by the way, to wear oxygen if you do require it during exercise, because again, your muscles are trying to improve and trying to get more efficient, and the fuel that they use is oxygen. Just can be detrimental in the long run without having oxygen. The other thing that I would say is that anecdotally, while there is some hesitancy for my patients sometimes to, go to a graduated exercise program where they learn uniformly, I have found that every patient who come back to me said they want more. They want more time with their rehab program because they've felt so wonderful afterwards. And a lot of patients tell me that they had no idea that they could do what they could have done in the rehab program without someone telling them, yes, that you can do that. So a lot of times, patients, and understandably so, have been suffering so long, they don't take the time, they say, okay, maybe I can't do so much, so let me take a look. And that's appropriate. When you're by yourself, you don't want to do more than you feel like your body can do. The therapist and the supervisors can say, look, you're actually doing great. Maybe you can push yourself a little bit, and it's safe to do so. And that is probably the safest circumstances in which it's okay to push yourself a little bit. And that's why I strongly recommend it to my patients as well. So I think there's a variety of benefits from cardiopulmonary rehab, only a few of which I've touched on at this moment, but I think the experience overall is incredibly beneficial for someone, especially when they move early on in their diagnosis and management.
Are there safety concerns and measures that someone listening thinking, I can just go to the gym on my own to do this, that they should have in place?
I think that's a great question. And it is important to know your limits to some extent and understand that those limits will get better as your heart and lungs get better. I do have some patients who have tried to go from what I call 0 to 60, go back to a full exercise program and go back to the gyms and things of that nature. And they end up feeling worse in the long run, or in the worst case, sometimes get lightheaded or pass out just because their heart hasn't adapted. That can be very dangerous in pulmonary hypertension. Now, this is by no means advice to not exercise or not go to the gym. If you don't have access to cardiopulmonary rehab for whatever reason, I think speaking with your physician in discussing goals for exercise in an exercise program is the next best thing that we can do. And I do think that it is okay to go to the gym. I just think it needs to be done with realistic goals because, again, what you want to avoid is your heart straining so much so quickly that you go into right-sided heart failure and end up result with the consequences of that, which can be dangerous or life-threatening. So there is an element of taking this to either extreme, basically not doing anything or taking it way too fast, way too quickly. Your exercise tolerance will improve. It will get better. It just needs to be done in a stepwise manner. And so that I would think that the important thing is, now, whether you go to cardiopulmonary rehab or not, speak with your physician about what you feel like you can do, how best and safely to do that. I do maintain still that exercise is safe if done appropriately and is recommended.
I think that's an important note here because I've had patients who spoke at our conference where they had a diagnosis. They went from being in the hospital, but then over time, they've run marathons. They've participated in other activities that really help to boost them, like you mentioned. Now, we obviously want to avoid going from 0 to 60, but are there any exercises that you absolutely would not recommend?
The answer is I don't think that there's any absolute contraindicated exercises that exist. I think it's just taking it to the extreme. For example, trying to lift weights over your head, which can cause your heart to work more, can be, difficult. I think it's the only contraindication I would say is trying to do a exercise which you feel in your heart is more than you can do and not discussing it with anybody. I think that is the circumstances that I would say is contraindicated. But in general, exercise in all forms is a very healthy habit to develop. The only other recommendation I would say is don't stick with just one type of exercise. Don't just stick with aerobic exercise and say, okay, that's all I can, that's all I'm doing and that's all I feel like I need to do. You have to vary exercises, aerobic exercises, strengthening exercises, yoga, tai chi, various positional exercises, posturing exercises. All of those matter because they build your muscles up in a different way, shape, or form. And all of that is important for your cardiovascular system to adapt again to what it was used to years ago.
Essentially, what I'm hearing is there's no excuse. There are exercises available depending on your level of activity. You can begin and slowly, gradually work up to a standard that you feel is best for your body. You don't want to go 0 to 60, but something as simple as chair yoga and then moving up and incorporating various forms could be beneficial.
That's 100% chair yoga. Pool aerobic exercises are the other thing that I've seen is incredibly helpful. Some patients might ask, I've got oxygen that I'm hooked up to a portable concentrator that doesn't maybe go to 7 or 8 liters, or I'm hooked up to a subcutaneous pump or an IV pump or an IV line. How can I sweat or exercise around that? The answer is you can. If there's a will, there's a way. And these are well-established ways of doing it. And again, speak to your physician about all these things, right? These are general guidelines, but patients sometimes attach the subcutaneous pump to their arm rather than their abdominal wall so that they can exercise or go in water sometimes. I've had patients have replacement batteries that they carry around for their portable concentrator so that they're able to get the correct amount of oxygen they need. I've had patients who have dressed their lines in such a way that they're able to make it almost sweat proof or protect it as much as they can. Again, important to speak to your provider and your care team about how to do this safely, but it is possible under circumstances to do that.
I think these are great options to put in place to make sure that you are still able to receive your treatment and still participate in an activity.
The only other thing is, again, keep an eye out for what I call red flag symptoms that are similar to what you had when you were first diagnosed. Lightheadedness, extreme dizziness, low oxygen levels if you're measuring that, breathlessness out of proportion. I mean, it is normal to feel a little breathless during exercise, but breathlessness that is out of proportion. Stop. Relax, and if the symptoms are not improving, seek emergency care. But I think that having an idea of what those red flag symptoms are, I think, are incredibly important.
And all of this, again, as we mentioned throughout this episode, please consult with your healthcare team, your medical team, or if you have access to the rehab, consult them as well, which I think is a good transition to, with you leading a team, how do you assess someone's fitness level or help them to create a personalized routine? Is that something you have a say in with the rehab?
So most cardiopulmonary rehab programs actually have a set a goal. Typically, what they do is they admit a patient into the rehab program. They'll get baseline assessments, baseline oxygen saturations, body mass index measurements, height measurements, weight measurements, oxygen levels with rest and exertion, and also typically do a 6-minute walk to get an idea of what their heart rate is doing with exercise. Because as we talked about before, a heart under strain beats faster with the similar levels of activity than a heart not under strain. And get an idea of just how they feel and make sure that they feel like they're safe to exercise. And actually, what they'll do is they'll come up with a program in conjunction with the patient about what their goals are in the next 2 weeks or month. I want to be able to walk a mile more than I did. I want to be able to climb, half a flight of stairs. I want to be able to go far enough to where I can go to the grocery store or climb up a hill, and set realistic expectations. And then that's when the work starts, being able to start the treadmill program or a bicycle program, things of that nature. And then towards the end, we remeasure these clinical objective markers, 6-minute walk distance, BMI, height, weight, things of that nature. And many patients have sometimes muscle tone as part of that as well. In the office, in clinic, we don't keep that much data, but we do measure 6-minute walk distances on a regular basis, as well as pulmonary function testing and just a subjective measurement of your activity tolerance and what you're able to do on a daily basis in terms of activity as of what we call daily living. And then we document noted objective improvements in those. And so keeping that in mind, that's why cardiopulmonary rehab programs are so important, is because they have the experience to be able to do this in a way that you not only feel better, but you see objectively that you have been improving over time.
And so with that over time, how do you help to set and then monitor throughout the course of their treatment or their exercising? How do you make sure they're on track to help meet those goals?
Right. Typically, a cardiopulmonary rehab program in the initial stages is done for about a month to 6 weeks. That's kind of how long the typically insurance approves for a cardiopulmonary rehab program. Sometimes you can get into what we call a maintenance phase, but the idea is in the goal of that period of time, with the number of visits that you get, usually about twice a week, goals are set up in such a way that you can realistically get to where you want to be within that period of time. During and after exercise, oftentimes, like I said, blood pressure is measured, heart rate is measured, and physical activity is measured. But a lot of times, patients can sometimes get worse before they get better. They feel like, oh my, I can't really get to the mile. And the supervisor says, no, that's okay. Look, your heart rate actually is lower than what it was with the same degree of distance that you walked from a day before. Or your oxygen levels are actually better than what they were before. And those are the type of things that are important. And remember, we start people on pH medicines and they work very quickly, but they do take time for the right heart to adapt to lower pressures in the lungs to allow more blood supply to go through it. And so that does take a period of weeks, if not months, to really improve someone's activity tolerance. And that's seen across all the studies that we use to approve the pH medicines in the first place. So it's not only your body trying to get better, but it's the medications that are working on your body to improve activity tolerance. And so that's important for patients to understand as well.
I want to highlight something you mentioned there, which is it's attainable. It's possible. You may hit a roadblock. It may not happen within that initial time frame. Give yourself grace. There are people like myself who hit roadblocks and are just, that's it for me. But for you to still want to continue while living with a chronic illness, applaud yourself. That is a win that you shouldn't take lightly because you are actually doing the work. You are actually wanting to increase your activity level.
That's 100% accurate. The patients I've seen who have been the most successful are the ones that have the drive to get better, no matter how sick they are. And I think that is a phenomenal thing to possess, because the intent of wanting to get better, wanting to improve yourself while setting realistic goals and working with people to do so, working with your providers and doing it in a safe fashion, I think are the ones that I've seen improve.
Do you have any other stories where people have increased or benefit from exercise within their routine, within their treatment plan?
Yeah, and I want to use a patient who actually didn't go through cardiopulmonary rehab, specifically because I want to talk about how she was able to develop something. So quite young, in her 30s, diagnosed with pulmonary arterial hypertension. She has two young kids, and extremely devastated by how she wasn't able to keep up with them when she was originally diagnosed. And she was able to get on therapy very quickly, and her exercise tolerance improved. And every time I saw her, I saw that drive that, whether it was explicit or implicit, to be able to improve herself. And we talked about realistic goals. We talked about how to do it safely. We talked about all the requirements. And it was a discussion that we had. And time after time, the thing that impressed me the most was just how much drive she had to improve her quality of life and to be able to run after her kids. And 6 to 8 months into their training, she came back and she said, I can't believe it. I went to Disneyland with my kids and I was able to do 17,000 steps in Disneyland, and I did it and I didn't feel a thing, and I felt amazing. And she was so happy about that. And I think that those are the types of patients that really get the most benefit out of the treatment that they undergo. And it's just having that drive to be able to want to do more while doing it in a safe approach. So a lot of patients who went through cardiopulmonary rehab, same thing. They've got amazing results early on. It takes the motivation needed to work on getting back to where you are and stepwise goals to achieve it safely, and wonders can happen.
Yeah, I think, and that is one of those unmentioned, unthought of goals. You said those realistic ones, but those ones that kind of sneak up on you are the ones who, like, I didn't even know that this was possible to be able to bring back to your team. I'm sure she was very proud of being able to do that. We can go on and on about this, but I think that's a point of hope to kind of leave, which I always want to inspire with these episodes, of that there is hope in listening to this information and taking it back to your team. Do you want to share any final thoughts with those listening out there today?
My last thoughts, I think I'll leave you with this, is that your body has gone through an incredible change while you've been diagnosed and are treating with this disease. Be patient, listen to your body, but if you do, it will get you where you want to go.
Yeah, that's perfect. Thank you so much, Dr. Muralidhar. I really appreciate you sharing your insights. And then I just want to remind everyone, for I don't know how many times now, always consult your healthcare team before starting any exercise program. You can look for more resources that we've mentioned here on this podcast episode about managing PAH by visiting our website at phassociation.org, also following us on social media. But I really want to thank you for donating your time and talking with us.
Thank you, Angela, for this opportunity. And it was wonderful speaking about this. So thank you.
And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights. Thank you for listening to this episode of PH Insights. We'd like to take a moment to thank our sponsors for their support of the PHA Connects program, which brings you the PH Insights podcast. Sponsors do not participate in the development of and do not endorse content of programming. For a list of our sponsors for 2024, please visit our website at phassociation.org/aboutph/sponsors. Thank you for listening.